Hi there.
Hi, Mr. Johnson. I'm Kate. I'll be your student nurse today. I'm hearing you're having some pain in your foot.
That's right.
All right,
Yeah.
well, I've got some morphine for you to hopefully clear that up.
Okay.
I also have an antibiotic for you today. It's going to be given to you because you have pneumonia, so try to clear that up as well.
All right, thank you.
All right, so before I give it to you, I'm going to just do my second check.
All right.
It'll be just 1 second. So I have morphine sulfate, 2 milligrams per milliliter. He needs 2 milligrams, so I'm going to give him 1 milliliter. It's due now through the IV, and it's being given every 3 hours as needed for moderate to severe pain. I'm giving it for him because of his pain in his foot. I'm going to document it later, and yes, we have Earl Johnson. So I'm going to take that off and clean the vial. Do that for about 20 seconds. I'm going to open one saline to use later, just normal. And then I'm going to open up one as well to dilute the medication in. So I need to put the needle on the syringe. Here we go. I'm going to draw back 1 milliliter of air. Uncap the needle, put the air in, draw back another 1 milliliter. Okay. A little more in there. There we go. I'm now going to call in my buddy or my charge nurse to just show what I have done. Okay. All right. Hi, Michael.
Hey.
I have drawn up 1 milliliter. I'm giving Mr. Earl Johnson some morphine sulfate. It's 2 milligrams per milliliter, so I'm giving a milliliter for the 2 milligrams. I'm also going to waste the rest of this.
Oh, okay.
Thank you.
Yeah, looks good.
I'm going to recap the needle. Here we are. Saline, I'm going to take that off and then get rid of some of this in the trash. That way I can have room for the medication. That was about a milliliter. Out of there. All right, I'm now going to label that. So I have Earl Johnson. Uh, 12, 12, 38. This is morphine sulfate. It is not expired. It expires 6/25, and he's not allergic to it. The concentration is 2 milligrams per milliliter. There we go. I'm now going to do a second check for the ceftriaxone. So I have Earl Johnson, 12-12-38, no known allergies. I have ceftriaxone for injection. I have a 1 gram bag, or 1 gram. It's in a 50 milliliters bag. The bag is intact. I'm gonna give it now through the IV. He's not allergic to it. I'm giving it for to clear out that antibiotic, and yeah, I'm gonna give it now. I'm gonna now prime this. So put that up there. All right, the first thing we should do is clamp it. Here we are. And I'm now going to spike it. Since this is sterile, it can't touch anything. Now I'm going to fill the chamber up about halfway. Go in a bit more. There we go. Okay. Now I'm going to go ahead and prime that. Slowly but surely it is coming. All right, it's almost primed. I'm gonna just clamp it for now until I get my other check done. I'm also going to, while I'm at it, make this a little lower, that way the antibiotic drips. All right, sweet. Okay, I am now going to give the morphine. Before I do that, I am going to do another check. Mr. Johnson, can you please verify your name and date of birth?
Yeah, that is 12/12/1938.
Okay, and do you have any allergies?
No, I do not.
All right, that matches them more. I have Mr. Earl Johnson, 12/12/1938. I have morphine sulfate and 2 milligrams, so that's 1 milliliter of that diluted into this saline. I'm giving it now through his IV for his pain. I'm going to document it after. Okay, so Mr. Johnson, with the morphine, have you had that before?
Yeah.
Okay,
Good.
so it works pretty fast, and one of the side effects is you could get lightheaded and a little dizzy, so call us if you need to get up. How's your IV feeling?
Oh, it's feeling fine.
You're not in any pain?
No.
Perfect. And I don't see any redness or swelling, so that looks great.
Okay.
I'm just gonna clean the side off before I give that to you.
Okay.
And I see that the IV is working because it's already infusing, so I don't need to do that first flush to make sure that it is patent. Do this for about 20 seconds. I think I touched it, so I'm just gonna do it one more time. Alrighty. Perfect. Okay. I am going to pause the machine, or pause the primary. All right, I would push this over 5 minutes. Let me know if you have any pain while I'm pushing this.
Okay.
wonderful. That went in great. This is not medication, this is just a normal saline, but just to make sure that the medication goes into your veins.
All right.
Okay, and how did that feel?
Oh, it feels fine.
Wonderful. Okay, I am now going to do my second check on my cefotriaxone. So I have Earl Johnson, 12/12/1938 cefotriaxone. I have 1 milligram in 50 milliliters. I'm going to give it now for his pneumonia. I'm going to document it later. He is not allergic to it, and it's compatible, so I'm going to give that with this. Oops. So I'm also going to restart this. Okay. I'm going to clean off the site. Oh wait, it's up here. 20 seconds. I'm going to unclamp this. And then I'm going to put it into the machine. I'm going to do secondary. And then since this is 50 milliliters and it's supposed to be given over 30 minutes, it's going to be a rate of 100 milliliters per hour. And then it is 50 milliliters. Start that. And just to make sure it's infusing, I'm going to see that it is dripping and that one is not dripping. So that all looks good. Alrighty, so Earl, I have finished giving you your medications. How are you feeling?
Oh, I feel fine.
Alright, well I am going to come back in about 30 minutes to check in your pain and to see how your antibiotic drip is doing. Do you have any questions for me?
I don't think so.
Alright, here's your call light. Your bed is down. Alright, I'll be back in soon.
All right, thank you.
Oops. Okay. Oh, I actually didn't do this, huh? I need to label my IV tubing real quick. Did not do that. So today is the 9th. It's 10 a.m. Okay.
Oh, hey.
Oh,
Yeah.
hi. Sorry, I forgot to put a tag on your IV tubing. It'll be just 1 second.
Oh, perfect. Thank you.
Alrighty, thank you.
Oh, yeah.
Okay. Document. Alrighty, there we go.